I'm Tom Cloyd, and I am honored, delighted, and excited to be joining Michelle Rosenthal at her trauma and PTSD blog at HealthyPlaces.com. Michelle and I share a deep interest and commitment to understanding, working with, and healing from psychological trauma disorders. We also share a strong belief in the value of information sharing, dialogue, and ongoing daily learning. Michelle has a PTSD story, and she's told it well, and I have one as well, but it's very different. It began with frustration some years ago. I was managing a rural mental health clinic in eastern Washington state, and I was aware that many of my clients were not benefiting like I would like for them to be from the services I was providing. It wasn't clear to me what the problem was, but I knew something was wrong. I went looking for alternative treatment procedures. I encountered one that got my attention primarily because it dealt with what appeared to be one of the central problems I was working with, and that was psychological trauma. Plus, it had a fairly solid research basis. It appeared to have been validated in some carefully done research. I got my agency to pay for the training required to learn how to do this procedure. I returned from the training, reassessed my caseload, and discovered to my surprise and dismay that 85% of my clients had post-traumatic stress disorder. I was a bit stunned. I was also reluctant to tell anyone for fear that I wouldn't be believed. As it turned out, I was believed. I was also told that the agency wasn't in a position to be doing anything much about how we approached our service population for a variety of reasons. I knew at that point that I would be leaving the agency. I had already been using the protocol. It was working. I was getting results. I was curing PTSD, and I was astounded and very pleased. Before very much time passed, I had left the agency, and I encountered a work environment in private practice which gave me new freedoms and allowed me to become very clear about who I am. I'm very concerned about what it means to make sense when we think about psychological trauma disorders. I'm very concerned that we not only make sense in what we say so that there's what we call internal validity, what we say hangs together, but also that we reference the reality we live in such a way that we are making sense there also. In other words, if someone claims to be able to fix a problem, they have to be able to actually demonstrate that capability. This is an issue of major priority for me. I'm also very interested in making sure that the people I work with and the people I talk to understand as much as possible what's actually happening moment to moment with someone who has a trauma disorder. This is often misunderstood. It's not understood in ways that are as helpful as could be. We can fix this by giving you correct information and models that are easier to understand than the ones you've had so far. I'm very interested in doing that. I'm also interested in dealing with the problem of helping people to understand that trauma disorders mean much more than post-traumatic stress disorder. It's certainly true that post-traumatic stress disorder encompasses more people in more situations than we originally thought. And that's an important thing to realize. But beyond that, we have found out in the past decade and a half or two that trauma is a concept that has great meaning in a wide range of disorders. Depression, for example, all sorts of childhood disorders. That this be better understood is a concern that's central to my work. I am particularly interested as well in making clear what we can actually do about these disorders, about how effective we can be. And I'm also intrigued by the problem of what you do after treatment is over. The word remediation comes to mind. How do you make up for lost time? What are efficient ways to catch up given that you have been held back by what's been happening for however long it's been happening. Finally, I'm particularly interested as well in talking about what we can do to lower the incidence of psychological trauma disorders. It turns out there are some very clear interventions in our society that, if implemented, would lower the incidence of psychological trauma disorders. We simply have to want to do it. I want to do it, and I'd like to talk about how we can go about getting other people to be engaged in these interventional activities as well. That's a lot, I know. This is a complex subject, and I think we have to attempt to do it justice, so we can't really leave any of those pieces out, I don't think. As one of my favorite poets pointed out once, John Donne, none of us really lives in isolation. We're all interconnected. We can and must use our connections to make the world more comfortable and safer for all of us. That's one of my reasons for joining the blog. I want to ask you to help me in my effort to do this. Give me your thoughts, your questions, your ideas. I'm very interested. We do have a lot to talk about.